Hi, let's talk about the maxillary artery. So it's the end of basically the external carotid. It's in three parts. So we're going to look at the major branches of these three parts. So we start off of the external carotid, and the first part is sort of the proximal, and we do a middle, and then do a third part, which is the distal end of it. So the first part has the middle meningeal artery. These are the major branches. So there's the middle meningeal, and you remember that goes through the foramen spinosum and feeds the meninges of the brain. And then we have the inferior alveolar artery, or the IA, which supplies all of the mandibular teeth, all of the mandibular periodontium and gingiva of those teeth. It also gives rise to the myelohyoid myelohyoid artery, which supplies the myelohyoid muscle. And then we have the incisive and the mental. So those are the branches of the first part. So here they are. Here is the middle meningeal artery, and it's a little hard to see. It's tucked up inside underneath the arch. That's going up through the foramen spinosum into the cranium. And then we have the inferior alveolar, which comes off and supplies all of the mandibular teeth. And a branch then exits through the mental foramen and becomes the mental artery and supplies tissues of the mental region. And the other branch continues on as the incisive nerve. So the incisive nerve again is only in the mandibular jaw, lower jaw. And then the last one is the myelohyoid muscle, which branches off, the myelohyoid artery, which branches off of the inferior alveolar artery and goes down and supplies the myelohyoid muscle. And somewhere we have to put the mandibular foramen, and it would be after the branch, of course. So somewhere in here would be the mandibular foramen, where it runs through the mandibular canal. So that's the first part of the maxillary artery, the middle meningeal, and then the inferior alveolar with its branches. And it's pretty much at the proximal end. Then we're going to do the middle part, or the second part, next. So the second part basically supplies the muscles. Most of the all the muscles of mastication plus the buccinator. So we have the deep temporal arteries, which supplies the temporalis muscle, the pterygoid arteries to the pterygoid, and the mesoteric to the masseter. That's pretty straightforward. And then we also have the buccal artery to the buccinator muscle. And remember that the buccinator is not a muscle of mastication, it's a muscle of facial expression. And the artery also supplies the region. So, on this figure, this is out of your text, of course, here are the deep temporal arteries going up and supplying the temporalis muscle, not to be confused with the superficial temporal artery, which is going up and supplying the soft tissues of the scalp and the skin. So we were coming off of the maxillae with the deep temporal, and then we have a mesoteric artery. I am not going to give you a picture like this with the labels removed and ask you to identify too much detail in here. But there is a branch that comes off supplying the masseter muscle. There are pterygoid branches that also supply muscles of mastication. And let's see. Oh, well, here's the whole maxillary artery. Of course, you've probably already figured that out. It's from here, basically, to here. All of this is the maxillary artery. So we have our deep temporals, and our mesoteric and our pterygoids, and those are our muscles of mastication. We had the lateral and the medial pterygoid. And a more detailed drawing, and here is the superficial temporal artery. And here is the maxillary artery. And all of this below was the external carotid. And you can see some branches that come off. We already talked about some posterior branches, just to review. And then here is an anterior branch. Here's the facial. So some of the labels are on here. That would make the one right below it the lingual, and the superior thyroid isn't shown. But back to the part, the second part of the maxillary. Here are what they are labeling. Well, let's just come over here. I'm not too concerned about tracing the leader lines. You can do that on your own if you like. But there are deep temporal arteries. You can follow those leader lines. The mesoteric artery. And the pterygoids, I think, are not shown on this. I suspect they're cut off right there, but that's okay. What else do we have? Here is the inferior alveolar, which was part of the first part. Goes into the canal, supplies the teeth. Better views later. Yeah, so we've done the first part and the second part, and then we're going to do the third part. So there are 4 branches. So this is the end of the maxillary artery where it branches off and gives rise to 4 major arteries. And they are the Sphenopalatine, which supplies the anterior hard palate, the periodontium, and the gingiva of the maxillary teeth. And that is, the Sphenopalatine goes through the Sphenopalatine foramen and the incisive canal. It basically follows the nasopalatine nerve. But now it's changed names, and we have a Sphenopalatine artery. And that is going to communicate with the greater palatine. So a couple of illustrations later, I hope, make this more clear. And another branch is the descending palatine. So we're going to look at these two together because they basically supply the palate. So the descending palatine artery gives rise to the greater and lesser palatine arteries through the greater and lesser palatine foramina, and that supplies the posterior palate, gingiva, and periodontium for those maxillary teeth. Third branch is the infraorbital artery, and terminal branches to the eye, the orbit, and the infraorbital region of the face through the infraorbital foramen. And the IO artery, the infraorbital artery, gives rise to the ASA, the anterior superior alveolar, and the MSA, if it's present. Not everybody has an MSA, so it's variable. And those supply the maxillary teeth. And then we also have the PSA. So we have the ASA and the PSA for the posterior superior alveolar. And that supplies the posterior maxillary teeth, gingiva periodontium. And those arteries of the PSA enter the maxillary tuberosity through tiny foramina, just like the nerves exited there. Okay, so here's an illustration out of your book. Again, the 4 branches I put in a yellow box, and I tried to group those together, keeping the Palatine together, and then keeping the IO and the PSA together, and those are going to supply the teeth. So at any rate, there are the 4 branches, and this illustration shows the infraorbital artery, and I put a yellow dashed line around those 4 branches. So here is the Sphenopalatine artery. It's shown, it's just been cut, so they're not showing very much of it. And then the IO, and then we have the PSA, and we have the descending Palatine, which isn't shown or isn't labeled, but it is here. Descending pal. Other figures, pal artery, do have it labeled. Okay? So that branching rises in the pterygopalatine fossa. So let's look at this in a different way. So here's a sketch that I made up. The green is the first part of the maxillary artery, those branches. So again, we have the middle meningeal, and then we have the inferior alveolar and the myelohyoid, showing the dental and alveolar branches of the IA nerve. So again, this is all IA, and it's an artery. No, we're not doing nerves. Inferior alveolar artery. And terminally, the mental and the incisive artery. Okay, the middle part is shown in blue, or the second part. That's going to our muscles of mastication, basically. So I put little labels on some because I couldn't write what I wanted to in there. But there are the deep temporal arteries to the temporalis muscle. And then A is to the pterygoid, and B the mesoteric, and that takes care of our muscles of mastication. And the buccal artery to the Buccinator is also shown. I sort of shortened that just to make sure it would fit in the drawing. Okay, so we've gone through that. Again, these are branches of this maxillary artery. At the very end, here within the pterygopalatine fossa, which is about here, little green dashed circle, is the PP fossa, pterygopalatine. Just so you kind of have a sense of where this is occurring. So here are the 4 branches at the end of the maxillary, the Sphenopalatine and the descending Palatine. And the descending Palatine is not labeled in this drawing, but it's this part that is descending from the end of the maxillary. and it gives rise to the greater palatine and the lesser palatine. I'll just put LP, lesser palatine artery. So that, of course, is supplying the palate, soft and hard, in the posterior. And then the Sphenopalatine artery goes through the Sphenopalatine foramen and then travels through the nasal cavity, giving off several branches within the nasal cavity. And this is the Sphenopalatine artery, and it anastomoses with the greater palatine artery over in the incisive canal. So you have the foramen and we have the canal. And those two arteries anastomose and form sort of like a ring road. It pressurizes this circle. So that's not supplying teeth. That's supplying the nasal cavity and the soft tissues of the hard and soft palate. And then let's take a look at the IO and the PSA, which do the teeth. Oh, we'll take a look at this figure first. So here is the branching within this pterygopalatine fossa that we mentioned. Let's do yellow. And there are the 4 branches. So we just did the Sphenopalatine artery. You come off of your screen over here on the left. But it takes off. Goes through the Sphenopalatine foramen, and it's hard to see going in there. And it then comes out and travels through the nasal cavity, giving off several branches, and then down into the incisive canal, where it hooks up with the descending palatine artery, and those two anastomose and cover the soft tissue of the palate. Also shows some of the other arteries that we were looking at, the deep temporal arteries, and the middle meningeal is shown. I mean, you can just look in here and kind of review. Superficial temporal. Okay, next slide. And this is the schematic of the teeth. Everything is the same that we looked at. The only thing I did was I cut off, didn't include the Sphenopalatine artery, and the greater palatine is still there, but I removed the rest of it that hooked up to there, just to get it out of the picture. And what we're left with are the other 2 branches, the infraorbital, which enters through the inferior orbital fissure, travels through the orbit, enters into the infraorbital canal, which runs sort of something like this. And the infraorbital artery continues on through the canal and out through the foramen to supply blood to the face. And remember that it hooks up and anastomoses with the facial artery that's coming up on the face and the angular artery, which continues on up the side of the nose. So we talked about that connection when we were talking about the facial artery. Well, let's do the teeth. So we have the ASA and the PSA. So the anterior superior alveolar artery comes off of the IO artery within the infraorbital canal and then supplies the anterior teeth. And the PSA, the posterior superior alveolar nerve, exits, branches off of the maxillary, enters again through those foramina in the maxillary tuberosity and hooks up with the infraorbital and supplies the rest of the teeth. So we have our posterior teeth and our anterior teeth in the maxilla, and if you have a MSA, it comes off of the IO also within the infraorbital canal, which I didn't draw properly. Okay, so those are the four branches. We have two ring roads. We have the Palatine, and then we have the teeth. So here is a better picture of the IO artery and the PSA forming those anastomoses and supplying the teeth. So here is our IO artery. And it enters through the inferior orbital fissure, IOF, enters the infraorbital canal. There's one foramen, there's the opening, there's the canal, and then the ASA and the MSA come off of that. So here are our superior alveolar nerves. Here is the ASA. Maybe make that a little darker. Right, or there's the ASA and the MSA, and they form these anastomoses and then supply the teeth. So we're pressurizing these blood vessel rings. And that was it. So, practice tracing a drop of blood to a tooth. Pick a maxillary tooth, pick a mandibular tooth, and just trace a drop of blood to it. And you're going to be coming off of the maxillary artery for both. Practice drawing a drop of blood to one of your muscles of mastication. Take blood to the face, by the side of the nose. Probably come through the IO, or you can come through the facial nerve, either one. Just start trying to put these together, trace a drop of blood to some of these structures that we've talked about in the slides. And the next and final lecture on this will be the drainage, and I think we'll just do all of that in one lecture.